Hi, my name is Marissa, and I will be sharing some information on teen pregnancy. Babies are great. They're cute and cuddly, and they're fun to be around, but they're also very needy, and when they want your attention, they want it right now. And I'm sure there are plenty of other things that you would rather be doing than waking up in the middle of the night to feed somebody or change their diaper when you have to get up early and go to school the next morning. So, if you decide to have sex, you have to consider the consequences of getting pregnant, especially as a teenager. In the 1990s, teen pregnancy was rare, and people were embarrassed to be pregnant. They thought that their life was over and they didn't know what they were going to do. Nowadays, being pregnant as a teen is a social norm. As you see in the picture, this teenager saying, "Oh my gosh, mom, call MTV," thanks to the show Teen Mom and 16 and Pregnant. One in three teens will become pregnant by the age of 19. In 2012, a total of 305,388 babies were born to women aged 15 to 19 years, for a live birth rate of 29.4 per 1,000 women in this age group. More than 1 in 4 teen girls who gave birth were ages 15 to 17. Teenagers are typically getting pregnant before they complete high school. 1 in every 10 new mothers is a teenager. Parenthood is a leading reason why teen girls drop out of school. After all, it is really difficult to juggle homework and a baby. Less than half of teen mothers ever graduate from high school, and fewer than 2% earn a college degree by the age of 30. Children of teen mothers do worse in school than those born to older parents. They are 50% more likely to repeat a grade, are less likely to complete high school than the children of older mothers, and have lower performance on standardized tests. About one-fourth of teen moms have a second child within 24 months of the first birth, which can further delay their ability to finish school or keep a job. Teen pregnancy is an important issue for several reasons. For example, there are health risks for the baby, and children born to teenage mothers are more likely to suffer health, social, and emotional problems than children born to older mothers. Also, women who become pregnant during their teens are at increased risk for medical complications such as premature labor and social consequences. A lot of teenage pregnancies are associated with increased rates of alcohol abuse and substance abuse, lower educational level, and reduced earning potential in teen fathers. You may think having a baby will make your relationship even stronger, but the fact is, 8 out of 10 fathers don't marry the mother of their child. It's also true that these absent fathers pay less than $800 annually for child support, often because they are poor themselves and can't afford legitimate support payments. Children who live apart from their fathers are 5 times more likely to be poor than children with both parents at home. The sons of teen mothers are twice as likely to end up in prison. The daughters of young teen mothers are 3 times more likely to become teen mothers themselves. 79% of teenagers who become pregnant are unmarried. 80% of teenage pregnancies are unintended. More than half of all mothers on welfare had their first child as a teenager. In fact, 2/3 of families begun by a young, unmarried mother are poor. Teenage births are associated with lower annual income for the mother. 80% of teen mothers must rely on welfare at some point. Within the first year becoming a teen mother, one-half of unmarried teen mothers go on welfare. If you are not ready to have a baby, then have a plan. Not having sex is the only thing that is 100% effective in preventing teenage pregnancy and, of course, STIs. If you do plan on having sex, then just make sure that you are using condoms the correct way, and if you do not know how, do not be afraid to ask.